Whoa. Watch out. Oh! Come on. Quitting while you're ahead. What's up, Chuck? And thank you very much. Today, we are back at it, breaking down and reacting to all the imaginative medical scenes and over-the-top injuries from Breaking Bad. Let's dive right in. Whoa. Watch out. Oh! Come on.
Come on.
I was not expecting somebody's head on top of a turtle or a tortoise. Interestingly enough, we see that the eyes are closed. If you actually shut the eyes, they don't necessarily stay shut. They kind of stay almost like at mid-range.
We need evidence back. Right, pretty big one.
So running away, people get nauseous. One could be the smell, could be the sight, and you get this wave of nausea that sets over, and then you could vomit. The most common medication for nausea that we give in the emergency department is actually Zofran.
What's the matter, Schrader? You act like you never saw a severed human head on a tortoise before.
He said tortoise. I guess it's a tortoise.
Welcome to...
Oh, thank gosh, he was queasy. Big explosive injury. Worry about, obviously, immediate death. Severed limbs, then punctured lungs, then lacerations, impaled objects into the body. So we got abrasion there. This would be probably a good situation for a tourniquet. These guys should have CAT's combat application tourniquet. I've done a video about that with Jen. If you guys are interested, I'll put it in the description below. Oh, so he's got a belt. A belt could work. I've discussed this before where you might not get enough tension on it that would actually decrease the bleeding. Will it slow it down? Yeah, possibly, but you really need to compress the area. And it hurts like hell, just so you know. Oh, man!
Oh, man.
Causing massive amounts of puncture wounds to the anterior chest. They'll cause lung damage, causing basically a pneumothorax or hemothorax. Could hit the major blood vessel relating to the heart. So it could be the aorta, it could be the brachiocephalic artery. Oh, nice. Head trauma and cervical fractures, okay. Skull fracture, intracranial bleed, a subarachnoid, a subdural bleed. Those types of bleeding do take time for it to kick in, so to speak. Again. Oh, stab wounds to the neck. It could hit the spinal cord, internal jugular vein, the carotid artery. Just depends how big of a hole that is left. The guy just gets tossed over the banister, one story up. I've said it before, major traumas are typically 3 times somebody's height, greater than 15 feet. Depends how you land. So it just means major trauma and needs to go to a trauma center. It doesn't mean major trauma injuries, but you have to have a high suspicion for them. Oh geez, what are these gonna do? You burn them? Oh no. Oh, awful, awful.
That's awful.
Besides the burn pain that you're gonna get immediately, then you're actually screaming and inhaling the flames into your airway, which will cause them to burn, slough off, then cause inflammation, but you'll also become hypoxic and asphyxiate, and you're not gonna be able to breathe.
Él es mi compañero, sí. Yo lo necesito. Él es mi compañero. Por favor, se lo...
Oh, the guy got blood squirted on his face. I've had this happen to me, but wearing face eyewear, which is important so it doesn't get in my mucous membranes. It's a potential exposure. Go to the eye wash station, make sure that you go through the right channels to make sure if there is an exposure, you document it and go on any prophylactic medications if they're required. Most of the time, they're not. The loud noise causing trauma to the ear. So you can actually rupture your tympanic membrane, or you can just get severe tinnitus, which is the high-pitched ringing of the ears, as well as decreased hearing in that ear. Could be temporary, could be long-term problem. So always use ear protection. Oh, they got him. What? Come on!
Come on!
The squirting blood out of the skull. Could that happen? Maybe. There's an artery right there called your middle meningeal artery on the inside. Maybe it's squirting all the way to the outside. Or you hit a vessel that is within the muscles of the temporalis muscle, which runs up on the side of the head there. You got to be careful of compressing somebody's neck while being held down, just because of the vascular structures as well as your airway. You may have decreased gas exchange. You can have a reserve of oxygen in your lungs for a period of time and still be conscious. Sometimes it's hard to expand your chest when you're actually laying down flat on it, because you need to expand your rib cage, which then makes it in tune difficult to breathe.
Es una muestra de respeto en honor de redundada amistad.
Zafiro Añejo.
Añejo is a type of tequila that's aged for a certain period of time. These individuals are enjoying some adult beverages. There's a product out there called Poor Decisions that helps with liver protection, alcohol metabolism, and hydration that me and my team at Life Happens has come up with. So definitely check it out. Oh my God, he's inducing his own vomiting. Please don't do that. It increases the risk of aspiration, which is inhaling your own vomit into your lungs, which can cause pneumonitis, which then could potentially lead into either abscess formations or pneumonia. When you purge like that, it increases the risk of esophageal rupture, as well as something called esophagitis. You can also cause something called a Mallory-Wise tear, or you can have Boerhaave's. Oh, everybody's going down. So some sort of sleepiness, sedative, hard to know exactly. Sometimes Benadryl can do this. Sometimes a benzodiazepine could do this. Sometimes a barbiturate could do this. There are different medications that could actually do this to an individual. Maybe that's why he induced vomiting, because he knew that this was in there, so he wanted to get it out quickly, because there is quick absorption of medicines via the stomach and alcohol. Oh, typically if you find yourself in a situation, or we find that multiple patients have had some sort of exposures, we'll call the Poison Control Center, 1-800-222-1222, free of charge for individuals to call. People come in worried they've been roofied from a medication called Rufalin, or another one called GHB. Those are not things that we can specifically test for in the blood. They used to use different agents to induce vomiting. Back in the day, people have heard of like Ipecac, but we don't do that because of the risk of aspiration. Typically, we would give somebody activated charcoal, but typically only if it actually would bind. Not everything binds to it, so then it wouldn't be helpful. These Breaking Bad episodes are actually really interesting. From a medical standpoint, good to talk about. Also, big new things on the horizon. Check out my brand new supplement company, Life Happens. If you guys enjoyed this, definitely check out this playlist right here. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.